Objectives of the lecture are listed on the slide. The rest is a metal extension of the partial denture that contacts a prepared rest seat. The purpose is to provide vertical support and direct forces down the long axis. Rests may also provide indirect retention, and provide a third point of reference. Rest seats are specially prepared on the occlusal or lingual surface of the tooth, to receive the cast rest. Ideally they are preparations that are limited to enamel, and will enable forces to be distributed axially. Rests may also be placed in custom-made crowns called surveyed crowns. The purpose of the rest is to provide vertical support, but also performs numerous other things, as noted in the slide.
There are several important things to remember. The metal casting must be of sufficient strength to resist breaking, thus the dimensions of the rest seat should be sufficient. Accommodation for the opposing occlusion must provide space for the rest. It is best to avoid points of habitual closure, if at all possible when preparing rest seats. Mark with articulating paper, if the proposed rest preparation will involve a point of habitual closure, re-evaluate placement of the rest seat. When possible, rests are limited to enamel, and avoid breaking interproximal contacts when possible. Rests are always rounded with no sharp line angles, and are prepared in such a way as to direct forces down the long axis. The rest preparation should never result in an inclined plane.
Rests and rest seats may be classified according to the tooth surface. Incisal rests are used sparingly. Each rest seat has an outline form with minimum recommended dimensions, but is largely dictated by the clinical situation such as location and size of the tooth.
The major rest types are described in tabular format.
Conventional occlusal rests are spoon-shaped. They require 1.5 mm reduction at the marginal ridge area. They are commonly placed on the inner proximal occlusal surface of the tooth adjacent to any dentulalis base. They are apically inclined, which permits axially directed forces. They are approximately the same width and length, about 1/3 the buccolingual width of the tooth. They are smooth and rounded with gently flared occluso-axial line angles.
The extended occlusal rest is typically used for mesially tipped molars, usually in the mandible. This form allows them to better direct forces down the long axis. They extend 1/3 to 1/2 the mesiodistal length of the tooth on the occlusal surface, and extend into the buccolingual groove area. The double occlusal rest seat supports the interproximal double occlusal rest. It is important to provide lingual access for the rest minor connector, as well as buccal relief for the clasp arms to exit. The rest must be sufficiently thick to resist breakage. Greater than 1 mm. Insufficient reduction and fracture is the most common problem. The contact between teeth should be preserved whenever possible. 1.5 mm reduction at marginal ridge. Rests are placed on both adjacent teeth to prevent wedging.
Cingulum rests are typically used on maxillary canines with a prominent cingulum. A common error is failure to check the occlusion and placement of the rest too far occlusally. Always mark with articulating paper. Place the rest apical to the point of contact. The depth width may be up to 2 mm, with a length of 2 to 3 mm. The preparation is an inverted V-shaped.
A ledge is used on the lingual surface, when the tooth does not have a well-formed cingulum. It is basically a 90-degree shoulder of approximately the same dimension as the cingulum rest seat. May be enhanced with composite, when necessary to get sufficient width. The ball or crawl rest is basically a small round indentation made with a size 6 to 8 diamond burr. Its round form permits rotational movements to occur without binding the tooth. It is usually placed on the mesial or distal side of the tooth. Check with a ball burnisher to ensure positive seating.
The incised rest is rarely used, saddle-shaped, concave when viewing from labial, 2.5 mm wide, 1.5 mm deep. The finished rest on the partial denture framework should restore the contour of the original tooth structure. It is most frequently noticed on the mandibular canine. Refer to the Kennedy templates found in the student manual. Rests are generally placed on teeth adjacent to the edentulous space, to provide vertical support to the partial denture. In the case of tooth tissue-borne RPD, they are placed on the tooth side away from the edentulous space. In the case of the tooth-borne spaces, they are placed more readily on the tooth side adjacent to the space. When used as indirect retainers or third points of reference, they may be placed anterior to the fulcrum line, as far anterior as reasonably possible.
Table format of rest placement shown. Most partial dentures may derive sufficient resistance to vertical displacement with 4 widely placed rests.